Phenelzine is a monoamine oxidase inhibitor used to treat atypical, nonendogenous, or neurotic depression. In this video, let's find found. What is Phenelzine? What is Phenelzine used for? Contraindication. What are the side effects of taking Phenelzine? How does Phenelzine work? How to use Phenelzine? What is Phenelzine? Phenelzine, sold under the brand name Nardil, among others, is a non-selective and irreversible monoamine oxidase inhibitor of the hydrazine class, which is primarily used as an antidepressant and anxiolytic. Synthesis of Phenelzine was first described by Emil Vodosek and Ottokar Lemminger in 1932. What is Phenelzine used for? Phenelzine is indicated for the treatment of nonendogenous, neurotic or atypical depression for patients that do not tolerate other forms of therapy. Atypical depression has a high prevalence rate, starts in early life, tends to last longer, is more likely to occur in people with bipolar disorder, has a high comorbidity with anxiety disorder and carries more risk of suicidal behavior. It is important to specify the atypical feature to predict the clinical course of depression and hence generate the best treatment and service. The features of the atypical feature include mood reactivity, 2 or more of these symptoms, 1. Increased appetite, 2. Increased sleep, 3. Leaden paralysis and 4. Interpersonal rejection sensitivity, and should not have melancholic or catatonic features of depression. Contraindication. Phenelzine is contraindicated in patients who exhibit hypersensitivity to the drug or who have pheochromocytoma, congestive heart failure, severe renal impairment or renal pathology, abnormal LFTs, or a history of liver disease. Side effects. Common side effects of Phenelzine may include dizziness, blurry vision, dry mouth, headache, lethargy, sedation, somnolence, insomnia, anorexia, weight gain or loss, nausea and vomiting, diarrhea, constipation, urinary retention, mydriasis, muscle tremors, hyperthermia, sweating, hypertension or hypotension, orthostatic hypotension, paresthesia, hepatitis, and sexual dysfunction, consisting of loss of libido and anorgasmia. Rare side effects usually only seen in susceptible individuals may include hypomania or mania, psychosis, and acute failure, the last of which is usually only seen in people with pre-existing liver damage, old age, long-term effects of alcohol consumption, or viral infection. Pharmacodynamic. The elimination of monoamine oxidase by Phenelzine results in the elevation of brain amines such as 2-phenylethylamine, which is a metabolite of Phenelzine. These amines have then marked effects on the uptake and release of catecholamines and serotonin in nerve endings. Phenelzine is shown to elevate brain levels of the gamma-aminobutyric acid, GABA, and alanine, ALA, as well as to inhibit the activity of the transaminases that normally metabolize these amino acids. In preclinical studies, it has been shown to be neuroprotective in cerebral ischemia. Mechanism of action. The basic mechanism of action of Phenelzine acts as an inhibitor and substrate of monoamine oxidase, which subsequently causes an elevation in brain levels of catecholamines and serotonin. It also presents a similar structure to amphetamine, which explains the effect on the uptake and release of dopamine, noradrenaline, and serotonin. Phenelzine has been reported to inhibit tyrosine aminotransferase, aromatic amino acid decarboxylase, and dopamine B-hydroxylase. Half-life. After administration, Phenelzine presents a very short half-life of 11.6 hours in humans. Dose. Depression. Initial 15 mg POQ8HR, increase not to exceed 20 to 30 mg Q8HR. Dosage should be increased to at least 60 mg per day at a fairly rapid pace consistent with patient tolerance. May be necessary to increase dosage up to 90 mg per day to obtain sufficient MAO inhibition. Many patients do not show a clinical response until treatment at 60 mg has been continued for at least 4 weeks. After maximum benefit from drug is achieved, decrease dose after maximum response, 2 to 6 weeks, over 2 to 6 week period to maintain dose as low as 15 mg q-day or every other day. Monitor blood pressure. Safety advice. Advice and warnings for the use of Phenelzine, Nardil, during pregnancy. FDA pregnancy category C risk cannot be ruled out. That's all the information about Phenelzine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.